Okay, welcome everyone. I'm Ed Sykes. I'm the director of Sheridan's Center for Mobile Innovation, and this 15-minute presentation is about an overview of this research center, overarching plan. We're going to talk a little bit about the industry and community partners. We're going to present the current research project we've got on the go, and talk a little bit about the research output, and then we're going to close off with a demonstration of our research projects that we've got. So first, just an overview and overarching plan of the CMI, the Center for Mobile Innovation. So we launched this center in the summer of 2017, and our focus is on mobile health. So we're very focused on creating innovative solutions to challenging real-world industry-driven problems using leading technologies, obviously in mobile, so application development, etc., but also related technologies such as Internet of Things, wearable computing, AR, VR, MR, so augmented reality, virtual reality, and mixed reality, and machine learning. So many of our current projects actually are leveraging a lot of machine learning research. Our objective is to work collaboratively with faculty and students and industry community partners to create these innovative solutions. So this Venn diagram really sums it up nicely. So we've got students, faculty, and industry partners working together, and we really believe in the synergy that exists in this type of collaboration. The CMI, so Center for Mobile Innovation, has two labs located at the Trafalgar Road campus. The first one here is in SCATE, so S401, that's the top level of the SCATE building. And as you can see, it's broken up into a number of different zones, as we say. So the first section here, this is our creative zone, sort of a creative space for people to talk and discuss and deliberate. We've got a little lounge section too, and then a work area, as you can see here, an open environment, very sort of modern and forward-thinking. And we've also got a meeting room essentially in the back to facilitate collaboration with our industry partners, faculty, and students when they come. Our second lab is in E113. So this is a recently renovated lab, where it's a smaller space, but we're very pleased that it also is in the same theme that we established in S401. So both of the labs are supporting the applied research work that we do. I'm just going to talk a little bit about our industry and community partners. As you can see here, this is a sort of a selection of our industry and community partners we've got at this point in time. As you can see, we've got a collection of hospitals as well. So Halton Healthcare, of course, the main hospital, Oakville Trafalgar Road Memorial Hospital is just up the road from the Oakville campus. St. Elizabeth is also a national healthcare service that provides support, personal support worker, as well as skilled trained nurses for people that have been recently just discharged from hospitals, for instance. So these are folks that provide superb care to ensure that people are on their way to recovery. We also have rich relationships with McMaster University. We actually were quite fortunate to receive substantial ORF funding that will establish a nice runway for the next 5 years and beyond in support of this type of applied research in mobile health. As you can see in the middle section is a collection of small medium enterprises. Perhaps you've heard of some of these companies like SOTI and Geotab, but CloudDX, PointClickCare, and Innovex, and so on. These are other companies that we have ongoing applied research projects with. And of course, supported by these large computing companies. So we have a long-standing relationship with IBM and Apple, Microsoft, TELUS, Rogers, and Google. So our product is innovative solutions, but our strength is actually faculty and students. So our faculty are quite different than faculty members at universities typically. They have a lot of industry experience, and they want to share this industry experience with students and in collaboration with our industry partners. So they have a lot to offer, and they understand the perspectives that industry So the the pressure points, the need to deliver, and the need to accelerate the applied nature of the research such that it meets the industry's needs. In terms of our students, most of our students in the CMI come from our honors bachelor degree in computer science and mobile computing. However, we are branching out. In recent times, we've been able to engage other students. So for instance, from the information system security degree, and most recently actually from the honors bachelor degree in interaction design in the Faculty of Arts Animation Design. We've been able to attract interest as high up as Tim Cook, the CEO of Apple. So you can see here, Tim is with our first cohort, first graduates of our mobile computing degree. So this goes back to 2018, and this is our first cohort. And here Tim is talking with them as the students are presenting their work from their capstone project and other coursework. In terms of metrics, these are just some highlights of the Center for Mobile Innovation and plans. So the number of projects that we've completed since CMI launched in 2017 is 19, and that also represents the number of industry partners that receive benefits from this collaboration. In terms of indirect industry and community partners that have benefited from this collaboration, there's 49 of them, and the number of students that have received salaries and acquired highly qualified skills and training is 60. The number of faculty that have been directly involved, that receives direct support in being involved in leading these applied research projects is 20. And the number of publications and other research output is 16 in terms of journals and conference papers. The number of events that we've presented showcasing the applied research work that we've done in the CMI is 20. So this slide is capturing more from the perspective of potential industry partners, but it might resonate with other stakeholders as well. So really believe in the talented students that we have from our honors bachelor degree in computer science and other degrees and programs at Sheridan. These students are super talented, and they are very eager to engage in real-world challenging problems with industry partners and with faculty members. Our professors are experts and leaders in their respective fields. We also have invested heavily in those two labs that I just mentioned in the CMI. So not only in terms of furnishing these state-of-the-art labs, but also in terms of equipment as well. So we were amongst the first in Canada, for instance, to receive the Microsoft HoloLens 2. We've recently spent a substantial amount of money in NVIDIA DGX stations, so high-powered supercomputers for deep learning research, and other equipment too. The last point here again is more pointed towards industry and community partners. So there is an opportunity to leverage the cash and in-kind that you provide by us to go for other grants to again sort of leverage these opportunities to accelerate your research forward. So there's many incentives from the government that are trying to foster this type of collaboration between academia and industry. In terms of current research projects, I'm just going to highlight 3 of them here. So the first one is the Clinic of the Future. And so this is based essentially on a product, a wearable device that was created by CloudDX. You can see it here pictured, and it's essentially just sits over top of the person's collarbone. You can see there's 2 sensors here, which are pulling off ECG information, and then there's a tethered component that connects to the person's ear. This is a very innovative device because it's continuous patient monitoring. So it's constantly monitoring the vitals, and it's streaming this information via Bluetooth. what's interesting is that it's pulling off, respiration rate, heart rate, movement, temperature, and including blood pressure as well. As you might recall, typical blood pressure readings are using a cuff, of course, and it takes time and it's cumbersome and so on. So could you imagine wearing this Vitality? You can actually run with it, walk with it, do a variety of different types of activities, knowing that all of these vitals are being captured in real time, continuously. So it affords a lot of different types of use cases and opportunities. So this project essentially is focusing on how would a doctor or nurse use this device in a hospital environment. So ward, for instance, filled with many patients wearing these Vitalities. So imagine a doctor essentially wearing this HoloLens and being able to instantly see the vitals in real time as they simply look at a patient. So imagine holographic images, panels showing up left and right as you're looking directly at the patient. And so this is essentially our current research project. It's been ongoing for several years now, and we're really excited about looking at the new features of the HoloLens 2. This research was aired on the Discovery Channel, so if you're interested, please take a peek at that later. Our second project that I'm going to present is about remote biometric assessment and monitoring. So this is with the industry partner Tech for Life, and it's basically acknowledging aging is a worldwide phenomenon, and we need to have better ways in which we can remote assess and monitor people in low cost scenarios, so low cost settings, and also at a low cost. So our particular use case was focused on pneumonia in children because it accounts for around 1 million deaths globally. And so we essentially created a low cost portable assessment monitoring kit and the associated Android app, as you can see pictured here. The intended use again is for remote locations and low resource settings. So the cost for this device is around $25. And the Android app essentially collects this information and uploads it to the MD Consults portal, which is essentially Tech for Life's EMR, so the electronic monitoring management system, so the EMR. And our current application is actually to assist in the assessment of COVID because of the distinct similarities between COVID and pneumonia. There's a great application in supporting triaging and the assessment of COVID using this device. A third example here is about authentic versus fake pain detection using machine learning and computer vision. It is in collaboration with Karmi Pain Clinics, so Dr. Karmi and his clinics. And the motivation again is about malingering is a problem that increases the cost of healthcare and fraudulent insurance claims. So malingering, of course, is fake pain, and that causes it's the root of a number of problems. And so our applied research challenge is how can we essentially delineate between truthful versus fake pain. And so what we're investigating is how can we use facial analysis, so using this Microsoft Azure Connect device, which is a 3D camera, and how can we use deep learning and micro-expression analysis and activation units on the face to essentially train a model, a classifier, that can discriminate essentially between truthful acknowledgements or truthful behavior versus malingering. And so this research is about creating a system that enables machine learning training and the creation of an algorithm that essentially detects if the person is exhibiting authentic pain versus fake pain. I'm just going to give an overview of the different types of research output that we've been able to accomplish in the short span of this center. Again, it's a relatively young research center. We have been in the news, so Opal News, for instance, Globe and Mail, and Maclean's. We have also been quite progressive in terms of writing research papers in top-tier journals and conferences. So here's just an example of several of them. And if you want to find out more, please feel encouraged to do so on our website, so cmi.sheridancollege.ca. And I'm just going to close off here with a demonstration that highlights a number of the research projects we've got on the go in the CMI. Again, please feel free to reach out to me if you have any questions. I'd be more than happy to talk with you. Thank you.